So it takes a little bit of time now just to go live on YouTube. Oh, great! I think we're live on YouTube.
All right.
Good. So now what I'll do is that I think I'll start recording. It takes a little bit of time just to go live. I just checked it. Okay. So yeah. Okay. So Luba, I think the whole world is watching us.
Excellent.
That's exactly what we wanted, right? Assalamu alaikum hammaga. Bizani kuzatib turgan aziz va hurmatli millatdosh vatandoshlarımizga bugungi webinarimiz ingliz tilida bo'lib o'tadi. Shuning uchun hozir ingliz tilida gapiraman. Assalomu alaikum everybody. Hello everybody. People who are following us on YouTube Live or Zoom. So we are very excited to see you here. So just to let you know that our session will be in English today. So Luba, how about if we're going to wait a little bit, like one more minute, okay?
Sure.
In the meantime, I'm just going to share the link, with people that I know on Telegram app, right? Social media app, so that, more and more people can join us so that they can benefit from your talk. So just a second. So let me actually share this link. I think the best technique that works usually in the Uzbek community is the word of the mouth.
Right.
Once you just started, it goes to people and other people. So word of the mouth is the best technique so far. So let me just share this. Okay. So yeah, I just shared this with some members of the community. I think we can just start. So okay, first of all, Luba, thank you so much for graciously agreeing to do this webinar, to give this webinar to us. We are very, very grateful that we actually found you. So just to let you know that I'm a moderator for this talk today. I used to be a member of the Uzbek American Association of Chicago.
Mm-hmm.
So it's an organization, non-profit organization, which basically introduces Uzbeks and Uzbekistan to Americans, but also this is the type of organization that organizes lots of like outreach activities.
Right.
And in fact, under the Uzbek American Association of Chicago, there's an Uzbek school that teaches Uzbek and etiquette and Quran, right? Majority of people of Uzbekistan are Muslim people. Uzbek people are, so that's why the kids learn the Quran, how to recite verses from the Quran, and also like be familiar with the Uzbek tradition, right? So I mean, it's roughly estimated, there is about like 1,000 to 2,000 Uzbek people live in the Chicago land. Okay. So like, for example, I live in Chicago, but there are lots of Uzbek who live in like Arlington Heights, right? And in different parts of Chicago and Illinois. So it's a small but very active community.
Right.
And during the COVID-19, right, we really couldn't hold our like Uzbek classes or get together in our office anymore. And that's why we decided to do outreach activities in the form of a sort of webinars. So far, I've moderated webinars that discuss the topics like teaching coding to students, how to get a house in the United States, or like immigration issues. I think Murakman Niazmatov, one of the lawyers from New York.
Right.
He's actually the one who highly recommended you to us. So
yes.
So that's how we know about you. And also many, like for example, I did a session on academic writing. So different people are doing like experts are doing webinars on different topics. So today we decided to do on mental health.
Yes.
And so it was interesting. Just to give you the background. Around 3 months ago, we were doing a webinar on a random topic. I don't remember. Maybe it was on like coding or like losing weight or healthy diet, one of those topics. And someone either from Pennsylvania or somewhere in Chicago, jumped up and said, "Can you guys also do on something related to, related to teenagers,
right.
like mental health, and also, this kind of topic, and we were lost a little bit. To be honest with you, I mean, yes, there are lots of Uzbek psychologists. I mean, we can talk to somebody from Uzbekistan and invite them over to give us a talk. But for us, but it was a little bit strange topic because, first of all, we're raising kids in the United States, right? And somebody from Uzbekistan giving a talk on identity crisis. Sorry, in this term, identity crisis. Someone coming us and giving us a talk on identity crisis from Uzbekistan sounded a little bit strange because we're raising kids in the United States.
Yes.
And we wanted someone who has this experience in working with teenagers who are growing up in the United States. Then Murakman Yazmatov recommended you to us, and you graciously agreed to give this webinar. So
happy to do it. Yeah.
Sounds good. So thank you so much again for your willingness to do this webinar. And just to let you know, guys, so my wife and Luba were in contact, and at some point we really wanted to do it in Russian, right? Because Luba, you're also a Russian speaker.
Yes, I'm a Russian speaker.
And then we were like, no, I mean, a lot of terms are in English, and we're in the United States. Maybe a lot of people will be familiar with English, so that's why we ended up doing it in English. So, yeah.
But I'm happy to answer any questions in Russian. My Russian has actually recently improved a lot because I came here when I was 11, so mostly of my academic stuff is in English. But I've been actually teaching in Russia a little bit, like I'm doing online classes in Russia, so that has helped. So I've gotten better at actually like doing like, academic or like, work presentations in Russian, but English is still easier. So it's good.
Good. No, good to hear that. So just to let you know, guys, let me just briefly say it in Uzbek. اگر رس دادم سوال بیارم وقتی بسیله بیام الان سوال بیارم. So if you guys want to ask questions in Russian, please go ahead and write it in the chat so that I'll be moderating this talk, right? So whether in Russian or English, so I'll be reading, or Uzbek, right? I'll translate it from Uzbek into English. So I'll be moderating this talk. So without any further ado, Luba, so if you can briefly introduce yourself, right? Your background, right? And also if you can move on and share your insights with us on mental health and identity crisis, we'd really appreciate it. Thank you so much.
Well, thank you so much. Thank you so much. Thank you for having me here. I'm glad to be here. And it's always nice to talk to like a different group of people than more than I'm used to. Let me tell you a little bit about myself. So I am a psychologist. Well, actually, let me start from a different place. So I came here when I was 11 from Moscow, Russia. So I do speak Russian. I do speak, English, obviously. I don't speak Uzbek. Unfortunately, my husband is from Uzbekistan, but I haven't cut on yet, but maybe in the future, it's like, one of the goals. So, but I am a psychologist, and what do? I have a private practice. And so basically what I do nowadays is kind of like this. I sit in front of a computer because since COVID, everything has been online, and talk to people all day long about things that are going on in their lives. So, which is what I want to talk to you guys about. So I used to work with a lot of children. When I was early on in my career, I worked with kids and adolescents. Now I really focus on adolescents. They're my favorite group by far. I think they're the most fun, to be quite honest, the most real kind of people. And I work with adults too. So most of my clients are people probably from age 12 to, 35. I have some older people as well, et cetera. So, and I've been in private practice for almost 10 years. Before that, I worked in foster care, worked in college counseling, worked in a lot of different places. In addition to my practice, what else do? I teach classes. Like I mentioned, I teach some classes in Russia, which has been a really interesting experience, really cool. I have been back to Russia a couple of times to do some presentations. One of my specialization is trauma. So that's what I was talking about there. I also teach at a couple of colleges. So I actually recently moved from New York. So my practice was in New York City for most of its existence. And we recently moved to the DC area. So now I'm in DC area. Now my practice is here. But luckily, I guess not luckily, COVID kind of helped in the fact that I can see everything went online. So I see people in New York and in Maryland as well. So that's kind of been interesting. So yeah, but like I said, my job is kind of like what you guys are seeing, me just sitting there chatting with you for, 45, 50 minutes all day long. So I think that's about the summary of me, but what I want to talk to you guys, yes, I'm going to talk about getting help for adolescents, but my biggest take home message is talk to us, talk to the psychologist. We're here to help. I think there's a lot of kind of misconceptions about what psychology is and what psychologists do. And if I have one goal, is to kind of break those misconceptions and tell you, like, we're really here to help. We're nice people. We're not going to judge you. We're not going to tell you what to do, and kind of help you learn about some ways that we can be helpful to you and to your family and to your teenager as well. So I'm going to start my PowerPoint. Let's see.
Sounds good.
All right.
Yeah, and just to let people know that we are currently on YouTube Live, and this webinar will be recorded and also uploaded on Uzbek American Association website, YouTube channel. So which is going to be present to you guys if you guys want to watch this webinar later, whenever you have the chance. Okay, Luba, go ahead.
Thank you. So I'm going to talk to you about adolescent mental health, but really the focus is going to be how do you get help for your teenager? I mean, adolescent mental health is like a whole class I would teach, really. So it's not something I can cover in the 30 to 20 to 30 minutes I'm going to talk to you. But my goal for today is to direct you to where to get it and how to get it and what is it all about. So again, I just want to put the message out there. We're a psychologist, social workers, mental health counselors, and I will talk about the differences between all those in a little bit. I'm here to help you guys. The APA, which is American Psychological Association, the big association of psychologists, they used to have the slogan, I think something like, talk to psychologists, the side effect is a better life. Meaning that, by talking to a psychologist, by talking to a therapist, really, there's no side effects per se. Yes, some therapists, I guess, are better than others. Some people will help you in a better way than others, but really you don't have much to lose by talking to a psychologist or to a therapist. All right, so here's a little video on adolescent development. I'm actually not gonna watch. We're not gonna watch it right now. I'm gonna ask the organizers maybe to send this around so people can watch, because like I said, adolescent development is a big topic. It's not something we're gonna really talk about today, but it's a cute little video that kind of, I think in 5 minutes or so, gives you a nice little summary. All I will say about it, as I think all of you know that have kids that are teenagers, a lot of things change at that point. Our nice, sweet kids that were very easy to get along with, sometimes are not so easy to get along with anymore. And sometimes it's fine, it really depends. But what happens is they reach a certain point in their development where they are kind of on their way to being adults. And I think there's a lot of very wonderful things about that. They have new interests. They are kind of their brain expands literally, they have new interests. They understand things a lot better. But there's also some things that are very difficult about it because their opinions might kind of get very different from their parents. Their cultural values might change. The way they might start doing some things that parents are not okay with. It might be they might start questioning parents' authorities, and unfortunately, also at this time is when a lot of mental health problems might develop as well. So I'm not saying every adolescent is going to have problems, because that is certainly not true. There's a ton of adolescents that do just fine, get along well with their parents, do well in school, etc. And there are some that are going to have some issues, but I think all in all, it's very different having an adolescent at home versus having a kid who's younger. So I'm just going to talk very briefly about what sort of issues might come up in the adolescence period. And again, each one of these things is a mental health issue, which I teach a whole class on, so I cannot kind of tell you about it in detail, but I will tell you very briefly about it. So all the things we have listed here are things that first develop in adolescence. They don't necessarily always develop in adolescence. They can also develop when kids are younger or when people are adults, but for the majority of them, they will start developing in adolescence. So depression. So what is depression? That's not just feeling sad. It's a couple of weeks of really low mood or not being interested in anything. Kids can be irritable. Kids can have an appetite, a change in their appetite, a change in their sleep, a change in their motivation, a change in their concentration, etc. In some severe cases, there are even suicidal ideation, which meaning a wish to die. So just again, it's not just feeling blue, and it's not just feeling sad. It's kind of a list of those symptoms. It's usually pretty noticeable to parents. It's not something, depression does not mean I was sad for a couple of days because, I didn't get a good grade in the test. It's really a pattern of behavior and feelings. And usually parents do notice. A lot of times kids will not tell you, oh, I'm depressed, but you can tell by their behavior and by how they're acting, and just again changes. Maybe the grades get worse. Maybe you start arguing with you more. And a lot of teenagers, depression becomes shows itself as irritability. Maybe they're very angry a lot. So again, don't expect parents to diagnose, their own kids. You certainly should not be doing that, but that is something for you to just look out, because while there is depression in kids, it becomes much more prevalent in adolescents. Anxiety. Obviously we're all anxious, we're all anxious, especially this year for various reasons. But again, there's a difference between, regular anxiety and clinical anxiety. Regular anxiety is just, we're all anxious about something at some point. Regular anxiety is clinical anxiety is when it begins to affect your life. If kids are worrying about things like, oh, I can't meet up with my friends because I'm worried about what they're going to think about me. If they can't stop worrying about something like a test, and not like a little bit worried, but just worried all the time, and they can't seem to stop. Again, it's going to look very different than just a regular everyday anxiety. Again, when does it become clinical? When it starts interfering with your life. I have the depression, anxiety in bold there, and that's because that's the majority of what we clinicians see in our practice. That's kind of our bread and butter, so to speak. Obviously, there's a whole bunch of other things that people come to us with, but depression, anxiety, both for adolescents and for adults, are the big two things. Okay, and again, it is possible. There's lots of anxiety in kids for sure, but it does start to develop in adolescence. Does it mean that it's going to be there forever? Probably not. Maybe, I don't know. But it does seem to kind of show itself at that age. And again, remember, you're looking for something that was markedly different from what it was before, right? You're looking for a big change. If you had a kid that's always been a little bit anxious, I mean, that's okay. Some people just have a little bit of an anxious personality, but when it starts interfering with what they're doing, it starts interfering with school, it starts interfering with seeing friends, it starts interfering how they're interacting with you, that might be problematic. It might be time to see somebody at that point. Panic sometimes goes with anxiety, sometimes it's separately. That's having a panic attack. So having a panic attack, I don't know if anybody had one, but it basically feels like you can't breathe. It feels like you're going to die, like you can't, like you're gasping for air. Sometimes people feel like the walls are closing in. Again, I think most people at some point in their life had a panic attack. I remember I had a panic attack once because I went skydiving and I jumped off the plane, and I jumped out of the plane with an instructor, and I was like, oh my God, I can't breathe. I'm going to die. So that was probably a panic attack. Other people have it in their other points in their life when things get very, very stressful. But if somebody's having like one after another, and especially when there's no reason for it whatsoever, like I had one client that was having panic attacks because they were at the grocery store. Then again, that might be something to look into. A lot of the times, panic attacks and anxiety go together, or even panic attacks and depression. A lot of times, I don't think it's happened so much with kids, but with adults, when adults have a panic attack, they think they're having a heart attack, so they end up in an emergency room, and then they're told that they just had a panic attack. Again, I'm giving you guys very incredibly brief summaries of all these things. Again, there's lots of information out there. I can give you like a 3-hour lecture on each one of these. But again, I just want you to get a flavor of things you might be looking out for in the adolescent period. Obsessive compulsive disorder, that's another one. It's not so prevalent because it's, I think, only like 3 to 5% of the population or something like that. But it could be a very debilitating disorder in terms of it consists of obsessions and compulsions. Obsession is a thought that you can't stop thinking about, and a compulsion is an action that you take because of that thought. So I'll just give you a few simple examples. Like, for example, if I'm leaving my house and all of a sudden I think I forgot to turn off the stove. And I'm worried because I forgot to turn off the stove, and I'm worried the house is going to be on fire. And then I go back to check. Okay, I went to check. Okay, the stove was off. Great. I'm leaving again. And then I was like, oh no, but I'm not sure if I left it off. And then I go back again. And then I keep going back like 10, 20 times, etc. Well, forgetting about the stove being on and going to check once is usually perfectly fine. But if you're doing it over and over and over, that's an issue. So that's one of one example of obsessive compulsive disorder. There could be other things like, it gets very complicated. For example, some people have different sorts of thoughts. They don't think it's okay. And then they let's say, I don't know, maybe the thought is, oh, I'm not a good person because I touched this black table. And then they try to neutralize the thought by having another thought. But if I touch it on the right, if I touch it on the right side of the table, I'm a bad person. If I touch it on the left side of the table, I'm a good person. If I touch it on the right side of the table, I must touch it on the left side of the table. So kind of doing that over and over until the thought goes away kind of helps a little bit in the beginning, makes you feel better, but it makes it worse. So people with OCD or obsessive compulsive disorder are kind of stuck in these patterns of these having obsessive thoughts and then doing these behaviors that initially help them feel better because they get rid of the thought, but it just kind of becomes a cycle that you cannot get out of. And that can be very debilitating because imagine if you are checking the oven or the stove like 25 times, it's going to take you forever to leave your house. Or like some kids have this thing like where they must check all their answers over in test. Like you have to hand in the test. You can't because you've just been sitting there and, checking it over 20 times. It's going to take you like 5 times longer than it should be. Again, just another point here, we all have some obsessive thoughts sometimes, especially when our anxiety is hard. But again, when it gets in the way of your life, that's when it becomes a problem. OCD or obsessive compulsive disorder develops also in adolescence a lot of the time. Eating disorders are a big one that develops in adolescence. That could be things like, again, I'm not going to go into a lot of detail, but anorexia, which is when somebody basically undereats to a point where they lose so much weight. It's very unhealthy. Bulimia, that's eating and then throwing up. And there's a whole bunch of other types. It's a very complicated disorder, pretty hard to deal with, but they do seem to develop in adolescence. And, substance abuse is obviously the last one that's abusing substances. It's different than experimenting with substances because adolescents do experiment with substances. It's pretty normal. But when you're doing it to a point where it's, again, getting in the way of your life and your functioning, that becomes problematic. Again, I gave you guys a very, very quick overview of these things, but these are just some things that mental health clinicians like me see in their office. Particularly for me, people usually specialize. Like I don't specialize in eating disorders. I don't specialize in substance abuse disorders. I do specialize in depression, anxiety, panic, OCD, and also specialize in trauma and some other things. I don't have that on here, but so those are some of the mental health issues you might see with teens. But, and I think this is kind of my bigger point today, you don't need to have a mental health issue to come see a psychologist because while that's a portion of how I see people dealing with diagnosable mental health issues, there's a whole bunch of other stuff that people come to me with to get help on. Again, parent-child difficulties. So, and especially with, I feel like people from different backgrounds and cultures, there's a lot of kind of differences in terms of how the kids' things should be versus how the parents should be, because the parents, grew up in another country, they have certain ideas about things. The kids grew up here, they have different ideas about things. And might not be such an issue when the kids were children, right? But when they become teenagers, when they have their own ideas, their own thoughts, etc., that's when it becomes a problem. So a lot of what I deal with is these cultural differences within parents and the family, meaning like kids think it's okay for me to do this. It's fine. All my American friends do this. This is no big deal. And the parents, they come from a different background, they have different culture. It's really not okay with them. So my job is not to tell anybody what to do, because that's never really a job of a psychologist or a therapist. It's just to help you work it out. For example, I don't do this here so much, but when I was working in New York, my practice was in Forest Hills, Queens. I don't know if people know where that is. I'm sure some of you do. There's a big population from Uzbekistan there. So I worked with a lot of people from Uzbekistan just exactly on these issues. A lot of the stuff that I work with was that parents did not want the kids to date, or they did not want the kids to date anybody outside of their religious group, for example. So that is, again, something that I work with a lot and something me and other psychologists could help you with. It's not a mental health issue. It does not mean you have a mental health disorder. It just means that might be a difficulty where you could use a third person who's be objective and who's going to be objective and non-judgmental to kind of help you work that out. So that's a big thing that I deal with. Again, none of these things on the slide are mental health issues. They're just normal things that come up between parents and teenagers that sometimes it's helpful to have a professional help you with. Peer problems. A lot of stuff that I talk about kids is dealing with their friends, like social skills, or, how to deal with fights with their friends, how to kind of navigate social media and all that stuff. Emotional regulation issues, difficulties is, again, when kids become adolescents, a lot of things that I see, they have very big, very strong emotions, which we all have emotions. Emotions are very normal things. If you're human, you have an emotion, right? With some adolescents, they tend to get very, very big, where they get very, very sad or very, very angry or very, very frustrated. And there's nothing wrong with that, but sometimes there's difficulty in how to manage them. So a big part of my work, how do you manage that big anger? Do you hit somebody in the face? No, that's probably not a good idea. Let's find some other ways that are more acceptable, more helpful for you to manage it. How do you, when you're so sad, you don't know what to do with yourself, what are some things that you can do? So big part of my work is teaching the adolescents how to deal with it, and then teaching the parents how to help their adolescents deal with that as well. Academic concerns, I certainly, I'm not a tutor or anything like that, and not a teacher, but a lot of times what I do is I try to help parents and help the adolescents figure out why they're getting behind, what's getting in the way. Is it a matter of like the classes are boring? Is it the matter they're not motivated? How do we get them motivated? Like how do we help them improve, etc. Again, I'm not going to be telling you need to do A, B, and C. I'm going to be kind of listening to you. I'm going to be listening to the parents and trying to figure out how to help you guys work together on these things. Again, my kind of goal as a psychologist always is not to tell you what to do. It's more how do I help you for your teenager and for you to have the best life that you possibly can and to function in the most optimal way. The way I kind of always explain therapy to people, it's like if you're the person, if we think of somebody at the gym lifting the big weight, you are the person lifting the weight, and I'm just here to assist you. I'm not going to lift the weight for you. I'm not going to tell you, go lift that other weight over there. I'm just going to try to help you lift that weight in the best and the efficient way that you can. Self-confidence. Self-confidence, again, a very big thing for teens. You have kids a lot of the time that were very kind of confident in themselves when they were younger. All of a sudden they hit 13, 14 and they feel bad about themselves. They don't know what to do about that. They don't know what to do about that. Something else I work on. Sexual orientation concerns, that kind of stuff, and gender identity concerns as well. So that kind of stuff becomes kind of a big important topic in adolescence as well. It does not mean it's a problem necessarily, but a lot of teens come and see me to talk about this stuff, especially when their sexual orientation, their gender identity is different from like the mainstream. So that is also something I work with. And a lot of the other work is helping parents come to terms with whatever it is that's going on with a kid, helping them understand, helping educate, helping them talk about it. So these are, again, my biggest point here, like I know I very quickly went over the disorders, and these other issues. Again, my takeaway point here, where yes, we certainly work on disorders, mental health disorders, but we also work on all this kind of normal stuff. So I think what I'm trying to say is, because you don't need a problem to go see a psychologist. You more need to if you want somebody's help to deal with some of these pretty regular issues that everybody has somebody who's objective, who's not judgmental, who's kind of like an expert in human relations, you could go see a psychologist and a therapist, and there's absolutely nothing wrong with it. I know some people love going to therapists, and their whole family's in therapy, and they think it's the best thing ever. And then some people are very kind of apprehensive about it because there's a lot of stigma behind it. Again, I just want to relate to you guys, there's absolutely nothing wrong with it. And another very important point is it's all confidential. I cannot tell anybody that you're even coming to see me. Even if you came and called me and said, oh, is so coming to see you, I cannot even tell you yes or no. We have extremely strict confidentiality rules. So there's no way of anybody finding out that you're seeing me, unless of course you choose to tell, whoever it is. So when to seek mental health help. So really the answer to that is anytime you have any kind of question about what's going with your teenager, if you notice any signs that you think are concerning, if you think there's something going on that you're not aware of, if you just kind of don't know what to do. Another really big reason to seek mental health help is if your teenager is asking for it. Please, if your teenager is asking to see somebody, even if you don't think there's any kind of issue, please indulge them, because likely they need something. Okay, kids don't usually ask to go see a mental health person or therapist without any need for it. So even if they don't want to tell you why do I want to go see it, if they're asking for it, please don't delay. Go do it right away. Because in my experience, like I said, if a teen is asking for it, there's usually pretty good reason. You yourself, if you were having some sort of, issue with your teenager, you didn't quite know what it was, you didn't know what quite to do, you can go get a mental health consultation yourself, not about you, but about your teen. And then the psychologist will kind of tell you, well, I think, you and I can talk about this, or I need you to bring your teen in, or this is some of the things that we can do. All right, so really like any kind of reason is good. I say if you have any doubt, any question, like don't be afraid of us, come talk to us. We're non-judgmental, we're there to help. And again, nobody's gonna really know about it. Okay, so where do we find a mental health professional? So I just here listed some ways because I get a lot of questions of people just calling me like, I can't find somebody, can you help me find somebody? So here are just some ways for you to do. It's pretty easy. So ask friends or family for recommendations. That is the easiest and probably the best way. That's what most people do. But I do understand that a lot of the times people don't want to do that because sometimes there's some stigma asking for a mental health professional. So another way is ask your child's pediatrician. Or just back to that first point for 1 second, just something to keep in mind. Certainly you can ask your friends and family, but just because somebody else likes this psychologist doesn't mean you're going to like that psychologist. It's a very personal kind of match between the client and the psychologist. So certainly you can ask, but just keep in mind, just because they were the right professional for your friend doesn't mean they're going to be the right professional for you and for your child. You can certainly ask your pediatrician. Most pediatricians have a list of psychologists or therapists that they like and they refer to. So they should be able to give you a referral. There's this APA psychologist locator, which I put all this stuff on there, whereas APA is our national organization. They have a list of psychologists by specialty, by area, et cetera. So you can certainly look on there. National Register is another association of psychologists. They also have a search. And all of those things in this the one after that, Psychology Today, which is basically a directory of psychologists and other therapists. It's very easy. You just go on there, you put in your zip code, you put in your insurance if you want to use your insurance, you put in the age of your client, of your child. You put like, there's a couple of other things. If you want somebody that speaks Russian, you can put that in there. If you want to put somebody who speaks Uzbek, and you are going to get a list of people with their picture and their descriptions of themselves. Do you still have to go meet them afterwards and talk to them on the phone? Absolutely. But it's going to give you like a little bit of an idea of who you're going to be meeting with. Google is a great one. Google is great because you just put psychologist near me. You're going to have a bunch of people pop up and you can cross references with some of that stuff up there. Just FYI, Psychology Today is paid. Like I'm on there, a lot of us are on there. We pay them to advertise for us. So it is an advertising site, but it is a directory. Again, you're going to have a psychologist, you're going to have their license, you're going to have their specialties, you're going to have all sorts of good information. I think most people find their therapist, unless it's from recommendation through Psychology Today. Your insurance company, you can always call your insurance company, go on their site, and they will give you a listing of therapists or psychologists near you. The problem with that, they really just give you names. They don't have any descriptions or anything like that. So a lot of people cross-reference the list from their insurance company with these other things that I gave you on here. State Psychological Association. So I'm sure Illinois State Psychological Association also has a list of psychologists, like New York does and Maryland does as well. Goodtherapy.org is another site where it's similar to Psychology Today. It's not as popular as Psychology Today, but people also use it. So all of these things are all the ways to help you find a therapist. There's a ton of therapists in the US, in the Chicago area. I'm sure there's like a huge amount. So you shouldn't have an issue, just more like narrowing it down to the person that's right for you and right for your teenager. Types of mental health professionals. I'm just gonna run through this pretty quickly. So in the US, I have 4 specialties on there, but there's more. Usually it's really state specific. So I'm actually not sure what's in Illinois, but psychiatrists are everywhere in the whole country. Psychiatrist is a medical doctor. And why am I going over this? I'm going over this because I think unless you're in the field, these are really confusing. And I get a lot of calls of people like asking to see a psychiatrist, and I have to explain to them I'm not a psychiatrist because I'm not a medical doctor. So psychiatrist is a medical doctor. The bulk of their job is prescribing psychiatric medication. There's some psychiatrists that do therapy still, but they're really in the minority. So the majority of their job is to prescribe the medicine. What will usually happen if you go see a psychiatrist, They may or may not give you medicine, but for therapy, they will send you to a psychologist or clinical social worker. Like I said, there are some psychiatrists that do therapy and medicine, but they're kind of very few in between. What happens with me most of the time, somebody comes to see me, if I do feel they need medication, at some point, I will refer them to a psychiatrist, and then me and the psychiatrist will work together to help you. The psychiatrist will do the medicine, I will do the therapy. I cannot prescribe medication. I don't have a medical degree. Which brings me to the next point, psychologist, which is what I am. I have a doctorate in philosophy, which is kind of really funny to say, but so I'm a doctor, but like my husband just likes to say, I'm not a real doctor, so I can certainly do the therapy. And I can do some other things like assessment and testing, which I'm not going to get into today, but I cannot prescribe you the meds. But I can recommend if that's something that's needed. So a lot of therapists, a lot of psychologists do therapy, which is well said I do, but it was just what I do. But other professions that also do therapy, like for example, clinical social worker, there or also licensed therapists. So if you go into something that's like psychology today, you're going to see that a lot of people are on there, clinical social workers. People always ask me, isn't it better to see a psychologist? My answer is really no. Like you could see a psychologist or a clinical social worker. I think if you're going to see somebody right out of school, it's better to see psychologists because we have a little bit more training than clinical social workers do. But I have a lot of colleagues and friends that are clinical social workers. And as long as they have experience and they have their license, they're just as good at us at therapy, maybe even better. Like, it really doesn't matter whether it's a clinical social worker or a psychologist. You just have to make sure that whoever you're seeing specializing in whatever it is that you're coming to them with. I don't know about Illinois, but in both New York and Maryland, we have something called licensed mental health counselor. That is another specialty that also can do therapy. A lot of times they're supervised by psychologists or somebody. Again, if that person is licensed or supervises somebody, they specialize in what you're looking for, you can also go see them. So my point is here, if you want therapy and the type of help that I just talked to you guys about for your teenager, you can go to all three of those. Like psychiatrist, like I said, is only for medication, but the psychologist, a clinical social worker, or licensed mental health counselor can all do the job. Just make sure they are licensed, okay? That is the most important thing. I would not go to an unlicensed person, especially in the US where there's so many licensed people. So what to expect from your first contact in therapy. So again, these are the points I just want to highlight it again. It's all confidential. It's a little bit tricky with kids or with teenagers because they always ask me, well, are you going to tell your parents, like the stuff we talk about? And I kind of tell them sort of, kind of. So I really want to keep most of what we talk about between me and the teenager. Otherwise, they're not going to want to talk to me about anything. But I always, kind of make these parameters. Like, obviously, if you tell me anything that's dangerous, I'm going to tell your parents. If you tell me you're being abused, I have to tell your parents. Also, your parents, most of the time, are paying for this therapy. So what I do is, like, you and I, meaning me and the teenager, are going to agree on stuff that your parents are going to know. And then we're going to invite your parents once every month or once every 2 months or whatever. And then together we can talk to them about it. At the end of the day, there's going to be certain things, especially when in a dangerous situation, that will tell the parents without the permission. But I really try to get the teens buy-in into this. Otherwise, it's not going to work. So like I said, with kids, I try to keep as confidential as I possibly can. But if there are things that I have to tell the parents, I will tell the parents. With adults and with families, like really, unless I have your written permission, I cannot tell anybody anything. Not the teacher, not the school counselor, nobody, like literally. There are some exceptions with like insurance, because if you're using insurance, I have to give them certain information, but it doesn't really matter. Like I can't really tell a whole lot to anybody. Again, therapists, by law, well, all therapists are very non-judgmental people. We're not here to judge what you do. We're not here to judge your parenting. Again, we're here to help. Maybe we'll point out some things we don't think are working well and see if you maybe want to try something else, but we don't judge in any way. And the big thing, therapy is really not about problem solving. I mean, sometimes it is, there's some things that I help you with. It's just more for you to figure out how you're going to solve this problem, how you're going to do it. Because I'm not you. I might live my life in completely different way than you would live your life. So my job here is to help you solve your problems in the best way for you. All right. So my job is to really kind of understand the situation from your point of view and how you see things and how you see the world and help you figure out what you're going to do. It's not for me to tell you, you should do this and this and this and that. So So what happened, let me just see here. What happens during the first session? So basically the way I start with, I get a phone call or I get an email, because everything is online now and I'm not really meeting people in person. So I schedule a 20-minute phone call. It's free, it doesn't cost you anything, where I basically just find out a little bit about you and your teenager and what you're looking for. The point of this purpose of this phone call is to make sure I can actually help you, because, I only specialize in certain things and not in others. If you call me, tell me, my son has schizophrenia, I'm going to say, I'm sorry, that's really not my specialty, but let me send you to the person that can. So I'll kind of get just some brief information to make sure you're appropriate for what I can help you with, to make sure, online therapy is going to be okay for you. We talk about insurance, we talk about price, et cetera, things like that. We talk about timing, which is also, sometimes a problem because people have different schedules. But importantly, most importantly, it's a way for the parent or for the client or whoever's calling me to kind of get to know me a little bit, be like, okay, do I even want to talk to this woman? Does she sound okay? So that's kind of our first contact. Then we schedule a first session. Like I said, all the sessions are online right now. Hopefully we'll go back to the real world in the near future, but first sessions, if it's for adolescents, I will meet with the parents, and with the adolescents, we first meet together, all of us, and I explain like limits of confidentiality and how, therapy works, et cetera. And those rules about confidentiality that I just talked about. And then I will probably talk to the adolescent on his or her own for a little bit. Again, the purpose of that is for me to get to know the adolescent a little bit. But the most important thing, and I always tell the adolescents that the purpose of this is for you to figure out, like, do you want to see my face every week or not? Because again, they don't need to trust me right off the bat necessarily because they just met me. It's kind of weird, but they look at me or they talk to me and say, you know what, this lady, there's no way that like I'm going to be talking to her every week. Like, I just don't like her. It's not a good match. Then I'm going to help you guys find somebody else. So my kind of goal in the first session is to get to know your adolescents, start building a relationship with them. Then after we're done with that, then I talk to the parents a little bit, kind of let them know just my kind of initial thoughts about the whole thing. And then if we decide, all right, we'll like each other enough, they're going to give this a try, we're going to meet for a few sessions where I'm going to do an assessment. Basically, my job there, two things. One, to figure out what's going on with your teenager, how it can help. And number two, to just start building a relationship with this teenager. Because in therapy with teenagers, relationship is number one thing. You don't have a relationship, you can forget about the whole thing. So that's kind of my job. And as we go along, we kind of figure out these are some of the things we're going to work. This is when we're going to bring in the parents. This is where we're not going to bring in the parents, et cetera. So everybody can stop at any time. It's not like a class where you sign up for 10 sessions. You need to complete the 10 sessions. We go for as long as we both feel like this is useful. A lot of times parents ask me, well, how long is this going to take? And I say, I have no idea. I mean, that's not 100% true. There's different things, if it's something like very, very simple, like, I don't know, let's say somebody has an elevator phobia. We can probably take care of that pretty quickly in a couple of months. But with teenagers, in my experience, because it does take a while to build a relationship with them, they're probably going to be in therapy at least 3 to 6 months, at least, a lot of times longer. So it's kind of an investment in the process. So you want to make sure you like your therapist, et cetera. So, and then we go from there. And again, I always welcome feedback from clients. I try to meet with parents as often as I can. And again, I'm just there to kind of help you and your teenager have the best life possible and the best relationship possible. Obviously, if it is a mental health issue, like the one that I've described in that a few slides ago, like depression, anxiety, the kids are going to be there longer. If it's perhaps just a family, communication issue, it might take just a few sessions. But a lot of times what happens, people come in and say, oh, it's just a family communication issue. And then turns out there's all these other things that we need to work on. So it takes a little bit longer. So that is my incredibly quick summary of trying to find the right help for your adolescents. I know you just gave you guys a little bit of tidbits of information, but hopefully, like I said, what I have convinced you of is again, we are here to help. There's really no side effects of seeing a psychologist as far as I know. Like I said, it's just a way to have kind of a friendly, safe conversation that hopefully will help you. And if it doesn't help you, you don't have to go anymore. It's really that simple. So here is my contact information. If anybody's interested or has questions, or if you want to take a look at my website or learn more about me, I'm happy to help and answer any other questions. So that's it. Thank you.
No problem. No, thank you so much. Thank you so much for your information. Luba. So, I didn't realize that, there is this, I'm familiar with Psychology Today magazine.
Right.
That's one of my favorite magazines, actually. I would recommend it to people. I really love reading their style, explaining things. I'm a lay audience, right?
Yeah.
As a parent, as an individual,
Mm-hmm.
and I really appreciate, this kind of input from Psychology Today. So now we know that they also have a list of.
Yep. So if you just click on if you go to the website, you click, you'll see if it's Friend Hub, find a therapist, and it's very easy. Like I said, I almost don't want to do this because they get paid, you know what I mean? But it is really the best way to find a therapist. And what I like about Psychology Today versus these other things, because there's psychologists and there's mental health counselors and there are social workers, and really I'm a psychologist, so I should be just promoting psychologists, but quite honestly, I've been doing this for 10 years. We're all good. You know what I mean? You don't need that PhD to be a good therapist. You can have your master's and be an excellent therapist, probably much better than me, honestly. So please don't let that stop you. Just as long as somebody's licensed, as long as they have the appropriate degree, you don't need a doctor in front of your name to help you. You really don't. So
sounds good. No, that's really good to know. I really agree with you. Like, in our culture, right, most of the time, especially Uzbek culture, like, there's somehow this stigma associated with psychologists, right? It's like we in fact use the Russian word to say psich, like,
yeah, right.
exactly. So that's why, and so there is this stigma. But one thing I like about the US, for example, US universities or like schooling system, is that there is always a psychologist, right? At the university level or at the high school level, and the kids have this opportunity, and parents have an opportunity to refer to them and ask for their, for advice,
Right.
And again, right, at the end of the day, we are thinking about that individual and his or her success in life. Right?
Right.
Okay.
And I feel like psychology is a very positive field. Like we're not there to tell you this is what's wrong with you. We're more like, okay, and I think a lot of psychologists like to come from a place of strength. Like this is what's right with you, and let's help make that even better, so.
Good. And, we have actually, a couple of questions. So if you don't mind, I would
Sure, of course, yeah.
One of your slides, it actually comes from one of the people who are following us on YouTube. You discussed the other issues, right? Some of the issues in one of the slides that the psychologists deal with, some other issues that involves parent-child difficulties, cultural differences with parents, right? Peer problems, emotional regulations, academic concerns, self-confidence, sexual orientation, gender identity concerns. So these kind of things. Okay. So imagine one of these things is happening in a sort of in a family, let's say in a family. So what is before even going to the psychologist, what are some of the things that parents should do, right? It's like, it's almost like if there is something, if your kid has a fever, right, you don't immediately call the doctor, right? Because there are certain things that you do to make sure that now you have to call the doctor.
Yes.
So if we just sort of use this analogy, what would be your best, like, let's say 3 tips the parents should do before going to psychology to deal with these issues?
Okay. Very good question. I don't know who it's from, but thank you. It's a great question. Number one, listen. You need to listen. You need to ask you if you have some sort of concern of any sort, even if it's not a mental health issue. You need to ask what's going on, obviously. And number 2 is listen. And what I mean by listen, it sounds very easy, right? Like we're all listen all day long, yes, to things, but really listen. You have to take a deep breath, especially if it's something that you don't like, you know what I mean? Or something you don't agree with. But really take a deep breath, put your personal feelings aside about it, and really listen to what your kid is trying to tell you. Because I think a lot of these issues kind of become worse is just because parents hear things, and we're all people, right? We're all people with our own personalities, our own anxieties, and etc. And it's like they say something, it brings up a certain reaction in us, and we're not listening anymore. So number 1 thing is listen, and listen carefully, and almost like say it back to yourself, like make sure you actually understand what's good. Say back to them, say, okay, listen, repeat it. I hear you say, there's a lot of tricks to this, but you can say, I hear you saying, and repeat it back to them. Make sure you're actually getting what's being told to you, because that's the number 1 thing.
Yeah, active listening, right?
Actively listening, exactly. That's number 1. Number 2, don't judge. Do not judge. We all judge every day. I know that. I'm a person, I judge every day. We all do it. But I think when it comes to your kids, and especially to your adolescents, and if there's any kind of thing, especially they're worried or afraid to talk to you about, I guess you can judge in your head. Like, I can't stop you from doing that. That's normal. But really think of almost don't think of your kid saying this to you, or think of your best friend saying that to you. Okay, if your best friend came to you with this issue or this problem of this statement, would you be like, I can't believe you said, you can't think? No, you wouldn't. You would listen, right? And you would support. So listen, non-judge, and validate. Validate is just saying, like, I hear you. You know, what you're saying makes sense. It doesn't mean you have to agree with it. I mean, here's an important point. I don't think you have to be like, oh yeah, it was a great thing to do, if you don't feel like that was a great thing to do. But like, I hear where you're coming from. I hear that you're sad. You know, I hear that you're upset, etc. Again, these things are much easier said than done. And that's why I think a lot of people end up in my office, because I think as a parent, it's very difficult to do that. And I'm not saying, I'm a parent too. And I think when my kid is young now, but I already know when he gets to be, it's not like being a psychologist. It's not going to help me. But if you can, again, try to go in with a calm attitude, if you do whatever you need to do, especially if you know that's something that's going to be upsetting, listen, don't judge, and validate. Again, does not mean you agree, does not mean you're like, you know, whatever, like you're supporting whatever the kid is doing, but you really need, like, the biggest issue that I see, other than the mental health, you know, stuff that I've talked about, kids don't feel like their parents are hearing them. Like, reason therapy is effective a lot of the time. And again, I'm not talking about depression, anxiety, you know, OCD. I'm talking about these other issues. Is I hear them. I don't have, like, what is that? I forgot what that phrase is. Like, I don't really, like, I'm not a part of their life. Like, you know what I mean? So I don't have any of those things and feelings about them. So I can really hear them. And I think they don't get that from their parents a little bit, which I understand, but that's, I think, super, super important.
Yeah, no, thank you so much for the advice. Yes, you know, a couple of really, really good points. You know, I actually jot down the notes because I want to translate some of them into Uzbek, because you're right. Like, you know, when you have something not shocking, when you have something that you haven't expected, right? The first reaction is like, boom. You know?
Yep. And I just want to add for the parents, like, same thing I just told to the kids, do that to yourself. Don't judge yourself. You're going to mess up. You're going to have, like, also be kind to yourself. Don't judge yourself, like, at all. Your kid is going to do something and you're going to react in a way which you're, like, really maybe are going to regret later. And that's okay, because you're a human being, you know? So model that for the kids. Like, okay, I messed up. I maybe screamed at you and I didn't need to, etc. So
ask question, listen, don't judge, and validate. Okay.
Yep.
Thank you.
I have a question to Luba.
Sure.
Please go ahead.
You know, Luba, you really mentioned earlier about those issues again, right? And I'm pretty sure that when you were in New York, you actually said you helped a lot of families. Do you mind sharing some successful stories? You know, how were you able to help with those issues? For example, dating, or I don't know, religious based. You know, when they had some arguments, like when kids had arguments with their parents. So, and I'm pretty sure that when it comes to this kind of, I don't know, core beliefs and things, I don't think that parents would necessarily agree or, you know, try to listen calmly, right? And I'm pretty sure that was the case. And that's the reason they actually, search for the help of psychologists. But if you were able to help some of those parents without mentioning their names, could you please share some successful stories? At least one, you know, will make a big difference, and I'm pretty sure will motivate parents to seek a specialist, right? Whenever they are facing this issue.
Right. So I guess my answer might be a little bit disappointing there, because so what I would do, it's not like, I think what I would do is just help people kind of understand where everybody's coming from, right? Like, so in a family situation where, let's say, I work with a lot of Bukharian people in Queens, Bukharian Jews from Uzbekistan, right? They're pretty strict things. Like, there's no dating outside of, like, they don't want people dating other non-Jewish people, for example, right? And I did have a lot of teens where like well, I'm in the US. I want to, or you couldn't be dating at all, for example, right? So like, but the kids be like, well, all my friends are dating non-Jewish people. Why can't I date non-Jewish people? I'm in the US, whatever. So I think where I would help there is kind of like help the teens understand that their beliefs are very different from their parents, and they have a choice, how they kind of want to conduct themselves. They can I'm not going to tell you not to date a Jew because your parent, it's just like, it's not my job to do that. I kind of help them understand all the options. There's a bunch of options. You can listen to what your parents are saying, and that will probably keep peace in the family, but then you're not going to be doing something you want to do. And how important is that to you? You can wait till you finish college and move away from home, and then you can kind of do whatever. Yes, that might cause some sort of attention. You can stand up to your parents, right? And yeah, that might cause serious problems for you. Let's go through what the serious problems are. Is it worth it for you? I can't make that decision for them, what they ultimately decide to do. So that's what I would do on the part of the teen. As far as the parents, again, same sort of conversation. I'm not going to tell you what to do. Like, I'm not going to tell you, don't tell your kids that that's wrong. That's not my job. My job is to be like, here's what the situation, I think sometimes I can helpfully just clarify the situation a little bit as an objective person. Here's what the situation is. You have certain beliefs, right? I'm not questioning those beliefs. Those are your beliefs. I totally respect them. You have a teenager who is a little bit different than you because they didn't grow up in Uzbekistan. They grew up here. Kids are different here. I understand that it's painful for you. I mean, a lot of the work I would do is kind of talk for the parents' feelings. That it's painful when your kids are not like you. It is, like, it really is. Like, it sucks, Kids don't understand that, but we understand that, right? It's painful. You feel like they're not being respectful. But the reality is, this is, you guys, like, we come from a certain place and they come from a certain place. And yes, you can go ahead and tell them, no, this is not okay with me. And yes, maybe your kids will listen, but then they're probably going to resent you. And are you okay with that? And then you have to make a choice. Maybe you're okay with it, and that's fine with me. But again, my job is going to be kind of clarify each outcome. I'm never going to be convincing the kids you should listen to your parents or you should not listen to your parents. That is not my role. And I will never be convincing the parents, oh, hey, you should change your beliefs. That's not my role either. But kind of just clarifying and showing me what all the options are and all what the outcomes are, et cetera. So again, basically, I think to summary, just to help you kind of communicate about that, but never will I be like, oh, I think you should do, no, we do not. In fact, if you ever go to a mental health professional that's telling you what to do in the situation, leave quickly,
Yeah, absolutely. Thank you so much. That's actually my main takeaway. I'm pretty sure that whenever you are facing this kind of issues, right, in the family, within the family, so the main thing is to have like someone neutral, right, like to find a third person, right, who's not going to be biased, right?
Exactly.
Yeah, so who's going to just listen and then accept both sides, and then so you're saying maybe advise, right, or lead them or show them the right way, or not show.
No,
but
no,
just no, right?
No, right. No. Yeah, just
not showing. So then you will help us to make the right decision.
Yes, I will help you get. And honestly, sometimes in a situation like you're describing, you all might leave my office without actually having resolved this. And like, honestly, I'm sure you're not gonna be too happy with that, but that's okay. But as long as you guys understand each other a little bit better, then I feel like I've helped, I've succeeded a little bit. Just let me add like a little caveat. There are a couple of exceptions. Like, there's certain laws in the US, right? About like child abuse. So that's one of the things about like where I would have to break confidentiality. So if you do tell me that you're abusing your child sexually or physically, I do have to report it actually to the proper authorities. So, and this is something I tell all the families right up front. And it is the law, and I have to abide by that law. So everything is confidential. But if you're telling me like, okay, I've been beating my child like every day, then I'm like, I'm sorry, I have to report this. So, and then, that's an issue because then you're going to have ACS come in and deal with it. But again, that is, I think, something that people should be aware of. So you really should know, like, yes, I welcome everybody should see psychologists. We're there to help, we're there to not judge. But when it comes to child abuse, you really should know those laws. So.
Good. Thank you so much. Thanks for the question, Savara. And also thanks for the great answer, Luba. So I have another question. So it actually came before the talk. I actually emailed a couple of people and I said, we're having this webinar with, psychologist. What kind of question you want you guys to ask from her? So this question came in Uzbek. I'll translate it into English. So there is a teenager, okay, who is in a class, and she's the only, or he is the only Muslim student or pupil in the class. And around the Christmas time, the people were asked to write an essay. But right after Christmas holiday, the kids were asked to sort of write a short essay about what they did during the Christmas break.
Mm-hmm. Did they actually call it Christmas break, or did they call it holiday break?
Here I think it mentions Christmas,
Right,
Christmas break, like Christmas tatıldan son, like after the Christmas break. So it was asked, and the kid didn't write anything because he or she was a Muslim kid. So what should parents do in this situation?
Well, I think it's my personal opinion. Like, the parents should probably go talk to this teacher. How old is this kid?
Early teenager, probably.
Early teenager.
Like probably 11, 12.
Well, it's 11, 12, it's an early teenager, right? I mean, I would also I would encourage the student to do that himself or herself, but it's harder, I think, at that age. But where was this? In Illinois somewhere?
Probably Illinois, yes.
Yeah, it's interesting because around, I know where I live in Maryland, in New York, they try to be very inclusive, about all the holidays and stuff. I know New York just started we used to get off only for Jewish and Christian holidays. Now we include the Muslim holidays.
Yes,
I think, and also in Maryland too, where I live here. Obviously, that is not the case to where this person is, unfortunately. I mean, I would actually have the parents, and I know it's and it's very unfortunate they have to do that. I wish they didn't talk to the teacher, right? Or talk maybe not even to the teacher, but to the administrators about hey, we actually don't celebrate Christmas. We celebrate, we celebrate these other holidays. And is there a way that we can make my child feel more included? Okay, they don't have to say Christmas break. They can say holiday, but it's very easy, So I think, and I wish it were not so. And I think that puts kind of the weight on this family to educate the school. It really shouldn't be that way, and it's sad. And again, I wish it weren't that way, but I think they have every right to say, hey, this is not inclusive. My kids is from a different culture. We don't celebrate Christmas. So
good. Thank you for the response. And Luba, another question is that before we even contacted you, one term. Basically, there was one term most of us were really interested in, which was identity crisis. Mm-hmm. Because one of the reasons we're thinking about this term is that because sometimes, when parents and the children let's say, right, in the Uzbek community don't get along because they have obviously differences. One of the things kid might say is something like, "Hey, I didn't end up living here on my own. You brought me here.
Right.
This place has its own rules and regulations. Sure. I'm growing up with these rules and regulations and cultures. So, sort of there is nothing wrong with me, or, it's probably you or something like this, and something along that line." And we thought maybe it has something to do with identity crisis. So my question to you is that, what authors or what kind of books would you recommend us to read that directly deals with the issue of identity crisis so that we are all aware of? Where does it come from?
I don't know. I don't know if identity crisis is the right term for this. I don't know what identity. Yeah. I think it's just. I don't know. I think it's just different. It's called acculturation, basically, right? So, I don't know if that's the right term for it either. But this is a situation where you have kids growing up in a very different culture from parents, right? And they have a certain kind of way of being at home, and then a certain kind of way of being outside, and it can be at odds, right? It can be very, very different what parents are expecting of them and what the society expecting of them. I can't think of a good, but there's a ton of popular literature. There's a lot of comedians that talk about that stuff, right? There's a lot of kind of populars that talks about this stuff. I think it's just developing your identity and of immigrant people, right? Mm-hmm. So, and it's a very kind of, it doesn't only happen in the Uzbek community, in the Russian community. It's pretty widespread. And it's not an identity crisis. I think it's just the combining of two cultures. And if you think about an adolescence, that's a very huge period developmentally anyway, right? A lot of things happen at once, and you're changing and you're figuring out who you are. And if children of immigrants, it's doubly hard because in addition to figure out who am I as a person, you figure out who am I culturally, who am I, which traditions am I going to keep, which traditions I'm not going to keep. And it's very, very difficult. And I encourage kind of parents to be kind towards that because it's hard. It's hard. And I think as parents, again, we want to say, all right, this is what I did and this worked out well. I want the best for you. I want you to do the same. But yes, these are kids, but they're totally different people. They're going to do what they're going to do. And like, you know, at the end of the day, they got to take their own path. And it's probably, yeah, if you guys stayed in Uzbekistan, or if I stayed in Russia, or if somebody else stayed in India or wherever, they would probably be like more culturally similar to us, right? But yeah, you brought them to different environment, different things. It's kind of like, yeah, and it depends. There's some kids of immigrant families that are just grow up, you know, observing things exactly like their parents would, but not many. Like, you know, you absorb stuff from your other environment and you learn different things, etc. So I always try to tell people to welcome that as a learning experience. You know, can you enrich your culture with other things from the US culture, other cultures, etc.? Can you kind of keep some of the traditions, or does it have to be so strict, etc., etc.? So I think these are kind of questions to ask yourself. I don't know if there's a good book. I didn't forget about that question. I can't think of anything right now, but I'm sure there are. And if I do, I'll let you know.
That's good. That's good. No, you're actually absolutely right. Right. I mean, you know, is there any way to enrich your own culture by, right, embracing some of the things that can work in your own culture, right? Like sort of embracing new, some points from the new sort of a new culture to your own old culture, and learn from these two cultures. Okay.
Yeah.
Thanks for this. And you know, we have one more question, which is basically like, could you please share any helpful links at the end, or any books that parents should read about, you know, mental health, like popular books? Or
I mean, there's so many. I think you have to give me a little bit more specific stuff. Like, there's just so many in every possible topic that you can think of. So you can watch the little YouTube video that I have on there in the beginning about adolescent development. I guess it's very, very short, but I think it does a nice summary. So there's a good book on. I mean, I think you have to be a little bit more specific with me so I can tell you, because there's a good books on like every possible subject that there's out there. So
sounds good. And you know, there are also people who are asking for your PowerPoint presentation.
Yeah, that's fine. There's not a ton in there, but yeah, absolutely, you can certainly give it to
because earlier you showed, like, you know, how to look for, you know, there were important terms and right issues.
Yeah. Oh, I didn't email it. I'll send it to you on the messenger, I guess, right?
Sounds good. Yeah, we'd appreciate it. Or if you can email my wife and Facebook, then we can make it available.
Yeah, you can definitely share it with that. And if people have questions, they're more than welcome to email me directly.
Sounds good. So we have Luba's email here, right? So then that's also your website, right? So great. So you're also available on you know, Facebook. I know that you are quick in responding, and we've actually thank you so much.
Yes. My one request, if you guys have like general questions, like Facebook is fine. If you actually have like, how should I say, like mental health, you know, like if you want to talk about like, oh, this is happening with my kid, email me, because that's more secure. You don't want, it's just a general statement. You don't want personal stuff out there on Facebook. Like, it's just not even on Messenger, because it's not the most secure thing in the world. So
no, you're absolutely right. Yeah. Because these are private, right? And
so I asked, like, anything, you know, Facebook is good for like, you know, setting up the workshops, that's great, but like anything, like anybody who wants to be a client of mine, please just email and phone, nothing else. So because what's going to happen if you message me on Facebook, I'm going to tell you, hey, can you please email me? So
good. Well, thank you so much, Luba.
You're welcome. Thank you, guys. That was fun.
For you know, informing us about, you know, mental health, especially in adolescence, and what we can do, what we shouldn't do, right, as parents, and you know, what are some of the steps that we have to take in order to help our teenagers.
Right. And also, like, just as a final note, we all make mistakes. You know, nobody's perfect. You know, I think I'm an optimist. I like to think in large, we're good people trying to do the best for ourselves and our kids. So we all do that the best we can. Sometimes we just need a little help, and there's nothing wrong with that. We're all there to help each other. So
exactly.
Right.
Well, thanks again. And
you're welcome.
I really appreciate your time, and I hope that, you know, this is not the first time we're talking. I hope that we can also do webinars like this in the future.
Sure, yeah, I'm happy to.
You know, this is, especially nowadays, right? Mental health is very important. I mean, with all these distractions and everything, and during the pandemic, so it was a wonderful webinar and a great presentation. You know, I really, really appreciate it, and I would like to express my gratitude on behalf of Uzbek American Association of Chicago, and also the people who followed us. So this video webinar will be recorded and uploaded on Uzbek American Association of Chicago's YouTube channel.
All right.
And some people might also end up asking questions on the YouTube. So thanks again, Luba. And also thanks for those people who followed us online and also participated in our Zoom webinar. Thank you.
Thank you. It was an honor to be here. Enjoy the rest of your Saturday.
You too. Enjoy. Oh, thank you, Luba.
All right.
Yeah.
We stopped recording now, right?
Yes, yes.
Okay. Good.
Now we can chat.
All right. All right.
No, thank you so much. I appreciate it. So if you can email the, if you can.
Yeah, I'll email you the PowerPoint. As far as like the resources, it's hard because there's so much. And I think like the problem is like,